afternoon, everyone. I'm going to call the Winnebago County Community Mental Health Board meeting to order. I will take roll call. Mary Ann Abadi, present. Richard Cooner.
Present.
Dr. Bill Gorski. Wendy Larson Bennett.
Present.
Dr. Ed Copeland. Dr. Terry Giardini.
Present.
Kim Neighbors. Linda Sandquist.
Here.
And virtually, I want to welcome Jeanette Towns joining us. And is Randy joining us today as well? Okay, thank you. And guests are Chelsea Glass, and then of course, Director Jason Wilkham. We also have guests in the room that will be coming forward for the presentation. So at that time, introductions will be made. But I do need to allow Tim Neighbors to enter virtually. He has COVID. He approved of us sharing that. So I need a motion.
Also,
Second.
Okay. Okay, all those in favor,
Oh,
please
we
say.
need to do roll call vote for this.
Oh, we are going to do roll call. Okay, roll call. Mary Ann Abadi, aye. Richard Cooner.
Aye.
Dr. Bill Gorski. Wendy Larson Bennett.
aye.
Dr. Copeland. Dr. Giardini.
Aye.
Kim Neighbor. Well, Kim's not here. Linda Sandquist.
Aye.
Okay. So the motion passed.
All right.
Hi, Tim.
I hope you're not too sick.
Yeah, I hope you're doing okay.
Waiting for that.
Yeah.
So you know, I-
For that. Okay,
Is he having?
Hello, everybody.
Hi, Tim.
Hi.
Sorry. I
Sorry
hope
about
you're
it.
doing okay.
Yeah. And
I'm getting there.
Hey, very good. Okay, at this time, we have no requests for public comment, but we do have a presentation, the Youth Mental Health System of Care Collaborative data presentation, and so I'm going to let the presenters introduce themselves. So if you want a podium, there is a podium, but standing up in front would be great, so people can see you.
Well, my name is Dr. Jody Kolwajit. I'm a school psychologist with Rockford Public Schools.
I'm Brittany Fry, work with Crusader Community Health, doing behavioral health case management with pediatric population. And so we're part of the mental health systems of care. I'm Christina Reddington, I'm the system of care navigator.
I'm Joseph Crown, Director of the Youth Mental Health Systems of Care.
Welcome, all of you. I just want, here's the speakers, so when you speak, for the public to hear, you gotta speak up a little bit, especially if any of you are going to speak in the back. Okay,
So the youth mental health system of care. So youth mental health system of care, we just have listed our vision. So it's a comprehensive, coordinated, equitable, and evidence-based youth mental health system of care designed to be affordable and accessible for all children, youth, or adults aged between 0 and 21 in the Winnebago and Boone County area. So the reason why this is important for our community in the Winnebago Boone County area is that in 2019, the Youth Mental Health System of Care did a gap analysis where we targeted clinicians and other providers in the area to see what services were being offered, kind of gaps and barriers in the care and access of services for patients in the community. And then 2 years later, this past year in 2021, we conducted a survey where we targeted consumers or would-be consumers. So individuals in the that age range 0 to 21 or families with individuals who could have access to mental health services in the community to see kind of what their experience was, what were the successes, what were the barriers, and that's kind of informing us of how we move forward with the system of care. And so next slide, we'll look at a bit more specific into what the result of the survey was.
So the responses were collected from July to December 2021. They were compiled in January and February 2022. During the collection process, we used snowball samplings, we used flyers, letters, word of mouth, social media, via emails. And what we'll find here is that the results from the 2021 surveys actually mirrored the surveys from 2019 when they surveyed the providers. And so there were 117 responses, 55% Winnebago, big majority Winnebago, and actually it might very well be higher because 17.7 were did not want services, and then 12.7 wanted services but they couldn't get them. 74% female, huge population that was white in the results. 67%, 12% Hispanic, 12% Black, African American, 3% biracial, other were 3%, and then 3% preferred not to say. Next slide, please. And then as far as the diagnoses, we found that 68% said that they had some diagnoses, whether it was mental health or otherwise. They had those while receiving those mental health services. And what's important is that the 32% didn't have them. So if we want to, work on destigmatizing that mental health, we don't need to have a diagnosis to get mental health resources. Next slide, please. And then we really followed up to see what they liked and disliked, and there was some overlap. They liked and at the same measure disliked the ease of scheduling, rescheduling. They liked and disliked the length of time from contact to first appointment. There was an overwhelming response that said that they liked the provider qualifications, the availability of in-person appointments and availability of virtual appointments. But then there were also responses that said they didn't find that there were enough availability of in-person and virtual appointments in our comments. So that was just the percentage that they liked those the most. They liked the distance to home, and that was something that we were worried was a barrier, but it really wasn't. And they liked the consideration of input. They disliked the level of follow-up from therapists, and then the lack of resources shared, like coping skills, things that they could take home with them. There was a lot of commentary on, they didn't feel like they had a good wealth of information they were able to get from their providers based on what they felt. And that led to, feeling like their needs were met. And they didn't like the intake process. There was a huge concern that there was not a lot of family resources because there isn't enough insurance or medical card providing organizations that provided family services. If you have medical insurance, you could get family therapy for your needs, but not if you are relying on state insurance. Next slide, please. So 37 actually said there was going to be overlap. So there are going to be different values because not everyone responded to every question. So 37 said they got mental health counseling. Then a good number also said physician appointments is where they got those mental health resources, inpatient mental health hospitalizations, and 15 would be psychiatry services. And then you'll see the trickling in of the substance abuse services outside county. There's also, crisis services and other. So these were, I think, the most informing quotes that we got from the surveys. So outreach workers for or in schools, local support groups for kids, school social workers seem to need help, unable to really help children with issues, intense outpatient truancy programs to address mental illness. Only resource we were given was outpatient program in the suburbs. Give kids more of a voice to report their needs, treat the whole family of a patient versus just the patient, and that's that family, the family services was set up a number of different ways. Affordable options. So if there isn't insurance, good insurance provided services or good services through Medicaid or Medicare, needs to be affordable. Shorter wait times from request to receiving services. And then it's also very clear based on what the responses were, the clientele and the providers don't have a good understanding of what all of the mental health resources are in reality in the region. There's not enough communication, so we're trying to build a system, and that's where we are. Next slide, please. How does the data inform us? So we want to inform communities on the mental health resources available, utilize the network for interagency referrals, so we can have more of a unified connection where we're talking to each other, and then create a uniform community practice. Have a uniform way that we can address clients' needs. Questions?
Go ahead, Gary.
Yeah, I do.
Yeah.
I was surprised, 117 respondents in the community our size. Now, what were you using? Did you say social media? Which ones?
Posted on, push on Facebook.
Just Facebook? Okay, okay, and that's probably the more reliable one to use. I'm just surprised it's only got 117 on it.
We posted them at community centers,
Okay.
at public libraries, at all of our agencies. We had a QR code they could just scan to go to it.
The
It's still
other-
only 117.
Yeah,
That's too bad. That's
we
too
also
bad.
had schools having family liaisons, sending letters and surveys
Mhm.
out to families, community members. We were sending it out quite a bit. I think one of the things that was difficult is it was done in a time that was quite trying for the pandemic.
Sure, sure. And with our public schools, some of the problems that they're obviously experiencing on a daily basis, I thought the parent liaisons could have done a better job of that. You know, in my opinion, they could have done a better job of reaching out to those families, because they're the ones that are directly involved with them, along with social workers and so forth. But I would have been on them a little bit more about getting out there, because they're your best resource. Okay.
Can I just get a little clarification on under results? Distance to home meaning how far away the services were, so accessibility is an issue.
Yes,
Okay,
yes.
and consideration of input, tell me what that means.
So the consideration of their input, what are they wanting to get out of the services?
Okay, all right, and that doesn't necessarily, that
That is
is,
something they like.
okay, all right. So, and under voices of our community, you talk about our outreach workers for and in schools.
Mhm.
So I'm just curious, would you say that the schools are aware of kids and families that need services?
Yes.
There just is a gap in the availability of services?
So, I mean, to be honest, when I was going through the results of the survey, I felt like it was pretty similar to what I am hearing from parents when I work with them.
Okay,
Families also tend to sometimes want more support for not more than crisis intervention, to provide support for trauma, to delve into trauma, which isn't always appropriate. I was gonna comment on that, but yeah.
but if that's what a family perceives to be necessary, is there a general awareness of services that are available, or is that a gap?
So one of the things that Rockford Public School District has been working on in partnership with Rosecrans is try to get more mental health clinicians in our schools. There's 13 schools that have Rosecrans workers. There's a number more that have KP. So I'm at Risa Middle School, for example. So we have a Rosecrans service there that's 5 days a week. And then we have 2 counselors, KP counseling, that's there 3 days a week.
Okay.
Lincoln Middle School has those 2 KP counselors, for example, 2 days a week. So it depends, it's based on the need and relative size. So there's about 1,300 students at Risa, 700 at Lincoln.
So you're talking
So
less than 5 full-time people in a school of 1,300 kids. That's not a
That's-
heck of a lot of resources.
that's in addition to 2 social workers,
Okay,
4 counselors, and myself as
Yeah.
a school psychologist.
Right.
And then we have a family support liaison, then we have 3 people from Move the Middle that's been providing a lot of push and support for students and helping them either in the classrooms or in the hallways with mental health needs. The other thing that we have is 3 family liaisons which, and that's just at recess, so it does vary by school. So there's 3 family liaisons, one for each grade. We have 4 assistant principals and 1 building principal. And I mean, they should be available to do that more than, I mean, just kind of put a Band-Aid on things in some sense, but in other senses, our goal is solution-based services, because we want students to feel safe and secure in schools versus necessarily delving very deep into trauma. And then we do SAS calls and get those needs met. If there are concerns for harm to self or others that are more significant, we'll do referrals to Rosecrans. We'll provide resources for youth mental health services within the region, which is now growing in our method in delivering those services that are available, because Ms. Reddington also has all of that looped in on this Google form where it's
Resource
interactive and it's a resource directory.
Is that part of the dealing with the communication about what
Yes.
resources are out there?
Yes.
Yeah, we've been trying to spread it, and then Jokie's been great at sending it to all the other school counselors.
Yeah.
Trying to get it in the hands of as many people as we can.
And families,
Okay,
yeah.
so kind of to bring this, I have one, do you have a question too, Dick? Okay. What I wanted to ask you, wanted to get the kind of the dots connected. I know what you're saying, your goal is to develop a resource guide or resources in the community, so you have a referral base or let people know what's available, so if they want family counseling. Well, the tax dollars that we are overseeing, that right now, we are really trying diligently to make sure that the unfunded, I mean, that's who our target is, seriously ill, unfunded children and adult population, get services in the community. So we have some new outlets, and I just want to make sure that while you're doing all of this, that you inform your population. Stepping Stones just opened a counseling center. They take Medicaid, they take uninsured, and they do family counseling kind of thing. So that's important that that communication is going both ways, so.
Yeah, no, I have heard about stepping stones, and I heard that did become more available in accepting state funding, but that was relatively recently, so. I
Yes,
think that
yes.
has been added to our.
Yeah, they are definitely on the resource directory.
And
Okay.
family council.
And
also.
family counseling,
Service
and,
network.
and the Loves Park school system, they'll take out of school district kids for counseling as well,
Oh,
and YSN.
Yep, and the family center.
Okay.
So my question is, going back, your collaborative covers what? Because, for example, you mentioned that certain percentage are from Winnebago. Does that mean outside of District 205? Is that the definition of who's?
We did, I mean, it was an anonymous survey, so we just asked respondents to tell whether they were from Winnebago or.
But your collaborative essentially is District 205.
No,
No.
it's
No,
Winnebago
it's the
and.
children's mental health.
So it goes up
And-
to the state
Yeah.
line.
It's 0, ages 0 to 21 and their families in Winnebago and Boone County.
Okay.
And just, we will be back next month to present a little bit more about what specifically our collaborative does. Just because of scheduling, we had to present the data this month, and then next month we'll be back with
That'll be,
a follow-up to this, what we're planning to do with this data.
that'll be wonderful.
Yeah.
Can we go back to the page on likes, just likes, please, for a minute? Because I'm curious, I'm just curious about, some of the dislikes, and so what does it represent in terms of percentages? Because, so for example, level of follow-up from therapists, what are they expecting?
Level of follow-up, that could be after you exit services or complete services, so there isn't as much follow-up as
Does
they
that
would.
mean connecting the dots with teachers and family, et cetera?
It could just be as much as following up with a patient or a
Okay,
client after
okay,
services.
Okay, so we don't know what percentage of people were saying that.
I do, I didn't
Okay,
include
all right,
those. If
okay.
that's something that we would want,
Okay.
I can include
And
that.
then see, I have the same question about, didn't have needs met.
Mhm.
Is that, should we worry about that? I mean, does that speak to competence? Does that, what is that, what is it saying?
It's saying that, I don't know.
Okay, right.
I mean, we asked if they
Okay.
felt that they had their needs met, and
Okay.
so,
Their perception.
Based on the perception of the respondents, if
Yeah.
they felt like they were trying to
Always.
access services and they weren't having their
Right.
needs met, they weren't being heard, whatever that
Okay.
was. I mean,
okay.
because of the nature of the survey, it wasn't like able to be an interview with an individual to get in depth.
But as we're interested obviously in
Right.
developing systems.
right,
And so those kind of, those sorts of issues are really important to us in
Right.
terms of like, because obviously we're putting services into place. We want them to meet people's needs, number one, number two,
Fill the gaps.
yes.
Sure.
we-
So in addition to what we're doing that will be discussed a bit more next month is working with consumers in the community. So we have a group that's helping to inform all that we're doing, and it's a group of consumers or like parents of youth
okay.
consumers to get more in depth on some of those pieces and go
Okay.
into like their
All right.
specific experience, what happened, so we can fill in those blanks for you to get a bit
Okay.
more direction and like how we need the system to function better.
And can I ask you next month, if you, as part of your, where you think you're going,
Mhm.
how we can support your work into the future? So what's your vision and how can we interact with that vision in a constructive way? And there are about to be a whole bunch of more resources, at least in theory, out there. So how do we drive this in the way we want it to look, you know?
well, land is over in one,
End of 2024 is when our grant funds run out.
and then, as far as, I guess the support going forward is to try to continue this system of care. And I mean, one of the things that we're doing is trying to make, we're working on this collaborative and also make sure that the community members are carrying or continuing this onward. So hopefully there will be people in the community that are leading this, and that we're more considered more consultants in the future, because they need to be driving what they need to do to get their needs met.
Hey, Jason, so your plan that's in the board today, this is a group that you would be seeing as working with them.
Yes.
Okay. Because the board itself developing a plan to promote collaboration and cooperation between services.
Yeah.
Okay.
Okay, so we're gonna have to say thank you so much at this point in time, so we can finish the meeting and
Thank you.
we appreciate it.
Thank you. Thanks for being here. Appreciate it.
You're welcome to stay. You don't have to go.
Okay, moving on, the monthly activity report is in the packet. Jason, did you have any highlights out of that you wanted to bring forward?
No.
Okay, that's very good. I mean, I saw what you're doing and busy times and more requests, and I think that's getting the word out to the community. That's good.
We did multiple presentations this month. We, when we first started doing presentations, a lot of them were driven by our initiation, and really over the past 2 to 3 months, all of the presentations we've done have been at the request of other organizations. So I think that continues to be something that we're offering as being available to do that, and that people are becoming more aware of.
Okay, moving on to our action items. I will need a motion to approve the June 2022 meeting minutes. Terry, thank you.
I'll second that.
And Linda second that. Any discussion? Hearing none. All those in favor, please say aye.
Aye.
Opposed? Okay, thank you.
Tim,
Good. He sounds
We
hoarse.
may need to do a roll call vote since we have one person virtually.
Okay, very good. I have to go back to my new order that of roll call. Let's see where- Well, Here it is, I've got it. Okay, Mary Ann Abadi, present. Aye. Dick Cooner, Dr. Copeland, Dr. Gorski, Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist. Aye. Wendy Larson Bennett.
Aye.
Okay.
Next
Oh,
one, do the alphabetical one at the bottom,
pardon me?
the alphabetical.
Well, this was, okay, I get it. This
No,
was
it's
roll
fine.
call.
Yep.
Okay, I'm looking for that sheet. I'm not,
We're not good at the meeting things.
okay, I've got it. She gave me a cheat sheet today, so
All
I
right.
know one's alphabetical, one's by
Okay, I
office.
got your back, Barry.
Oh, Lord, I've got to remember all this, okay. Okay, so we are moving on, that the minutes were approved. Next is our resolution number 2022 to 2025, authorizing funded program budgets, updates, and advance payment for the program year 2022 to 2023. So Jason, do you want to speak about this?
Sure, so these are some of the approvals that we made were based on partial budgets or there were special conditions that implicated changes to budgets. So this is the result of that. These are organizations who have updated their budgets according to what the mental health board authorized based on the funding amount, or in some cases based on what we dictated as a work plan condition. There were requests for line item changes to meet the deliverables. So each of those are outlined in the resolution
Yes.
with the specific changes being requested, and every line item is itemized. If you have any questions about one of the specific programs, we are happy to answer that.
Right, and they were all in your packet, so
Yeah.
for review.
So I move that we accept resolution number 2025,
Oh,
Right.
sorry.
resolution authorizing funded program budget updates and advance payment for the program for years 22 to 23.
I need a second.
I'll second.
Wendy, okay, thank you. Any further discussion?
I would like to add one more thing. So as you know, the second part of the resolution is and advance payment. We dictated to create standardization this year that the default status would be a monthly reimbursement for each organization, and that advance payment would only be based on request with board approval. Youth Services Network had done advance payment last year, and they found that based on their cash flow concerns, that advance payment would allow them to operate their program most effectively. And we believe from a staff perspective, based on how they operated their advance payment program last year, that they were in perfect compliance with it, that they submitted all of their reports appropriately, and that we were able to work with them on the advance payment without any issue. And so I would just add that note that this resolution is also authorizing for them to continue on advance payment basis this year.
Okay. So any other discussion? Hearing none. All those in favor, please
Roll
say.
call.
Pass
the bottom.
It's money.
Not, no, roll call is at the top, so the voting roll.
Yeah,
call.
sorry, the roll call.
Okay, Dr. Copeland. Dr. Jardine,
Yes.
Dr. Gorski. Richard Cooter,
Yes.
Wendy Larson Bennett,
Yes.
Tim Neighbors,
Yes.
Linda Sandquist.
Yes.
Mary Ann Abadi, yes. The motion passed, Jason.
Okay.
We have one more action item, and that will be for the fiscal year 2023 mental health board budget. And I'll let Jason take this away.
Okay, so you'll see in the Well, first of all, let me preface this by saying, I had originally intended for this to go on the August meeting packet as we had done last year. The county is a little bit ahead of where they were last year, and so they requested this sooner from us. So I put this together. Luckily, already had done some pre-work to have it, so we did put this together rather quickly, but nevertheless, I think thoroughly. And we have an entire packet here that shows kind of some of the goals. This is a county template essentially that asks for the goals and the mission of the board and what our key performance indicators are. We have our work plan from last year showing the status of what has been completed and what is still in progress. We have a draft of an updated work plan for 2023. I'd like to note that approving the budget is not an approval of the work plan. I would still like to refine the work plan and put it onto the August meeting for approval. This was just preliminary to give an idea of what type of activities we'd be doing this next year. So in terms of budget amounts compared to last year, the dedicated technology subscriptions increased by 10% due to inflation costs and to make sure we are covered for any increases in subscriptions. Number of technology companies are increasing subscriptions right now. If you have any of your streaming subscriptions, you might have noticed that they're starting to, the venture capitalists don't want to subsidize your viewing anymore. And so the same thing's happening across many of the subscriptions. We are protected with our largest dedicated technology, which is our grant making platform, Foundit. Our contract dictates no more than a 10% increase year over year. So we know that we're very confident that 10% increase will cover everything that we're currently using to continue without any interruption.
Jason, could you give, so that's
Yeah.
that's an example. So the grant platform that you're using, you're essentially talking about the software that you're using
Yes.
in order to manage this whole thing. Okay, so we have,
That's the largest
that's the
expense.
largest one, right?
Right,
Yeah, I believe that's roughly $6,000 or $7,000.
Okay,
There's we use a Zoom, a dedicated Zoom account that allows us to live stream our meetings and have
All right.
virtual meetings. We have a MailChimp account that allows us to do a subscriber-based information sharing emails out to,
Okay.
so people can subscribe for updates on our website. And so every time we have a board meeting or we put out a notice of funding opportunity, it goes to a subscription list of people that have signed up for updates. We have Canva account, which we use to do some of the branding and logos and things like that at a lower cost. We also have a dedicated Adobe account that allows us to do the reports that we put together and make them look pretty and nice.
good.
Yeah.
Okay.
Those are the main subscriptions that we have.
The next one, system coordination. What are we talking about there? That's a big number.
Yeah, so systems coordination actually was a line item in this year's budget for $50,000. Systems, what the intention of that was to start funding outside of the grants themselves, some of the things that we want to do as a function of being that coordinating body at the outer layer of the system of care in the community support system model. What was recommended by the board and what we have done is establish a systems coordination plan before we start spending any of those dollars. And so from the systems coordination plan, which has been added to the meeting packet as a discussion item this week, and pending no major changes would go on the August meeting for approval, what we can start doing and what our funding policy actually allows us to do is to do requests for quotes for specific types of services. So if one of the things in the systems coordination plan, we wanted to hire a service to do that. If we wanted to do a ride share service, for example, as other mental health boards do, and they hire and contract with a specific ride share organization so that anybody in the county can have a ride share paid for to go to a mental health appointment. That transportation is never a barrier to keeping somebody from making a mental health appointment, we could put that out for a quote, we could do a procurement for that, and we'd have funding available to start that service. $100,000, just for an example, to give you a parallel, that is the exact amount that McHenry County spends each year just for their rideshare service.
Okay. Okay.
And I have to say, I spent some time with Jason last week, I guess, going through this, and he mentioned that, and I'm like, this is very exciting. You know, this would open
Well,
up
it ties
resources.
it all together.
It does.
I feel like.
Yeah, so we kept that separate from grants because we can do that through a different procurement mechanism where we put it out for quotation rather than having kind of a larger grant, responsive grant making type request.
Okay, so then down on the totals, total administration and coordination expenses. I mean, obviously, there is our contractual arrangement of the 402,000. So then what is the coordination expenses in addition to that?
Everything in the top of the budget
Right.
Okay,
is included in that amount, and it's
Okay.
just differentiated from what we
Okay.
spend in
All right.
grants, right? So that includes technology, it includes legal counsel, it includes association dues, it includes training, it includes insurance, or the board's insurance for directors and officers and professional liability, errors and omissions and general liability. Oh, sorry, we do not have general liabilities, errors and omissions and directors and officers. And then it does include that 100,000 of system coordination. So all of that total comes to less than 3% of our total budget, and over 97% is still going out to agencies
Right.
for direct service.
that's the important.
Yes.
The other important piece is looking at, because I was looking at the 402 contractual arrangement for administration as compared to the 20 million. We're not talking, it's not even.
Yeah,
It's
the-
ridiculous.
1%.
The average mental health board spends over 10% in administration. I
Yeah.
think the total is 14% on average, right? So we are operating, including all components of administration and systems coordination at less than 3%. So if you're looking just strictly at the administrative costs, it's 2%, less than 2%.
Right.
Yeah, and I will bring up the fact that I have concerns that now it's getting towards the end of the year. So I know that Jason has had at times to restrict the amount of time of his staff because he is very aware of the budget. I never want to be in a position where we cannot just, if things need to be taken care of, they need to be done. And we cannot worry about, we have the funding and we would never go beyond our limits of authority. But I want to just put that out there
Well,
that
I think we do have the authority.
we do
To
for a current
expand,
amount, yeah.
you know, to change a line item when it comes to personnel. And I think we talked a little bit about this, that some of the system coordination is going to require additional people to, as we have more going on, you know, we just signed a huge stack of proposals.
One of the great benefits of the planning council model is that we do have the ability to use staff as needed in a particular skill set. So for example, we have a graphic designer on staff that I can use whenever we have a report that needs developed, but I don't have to have a full-time graphic designer, right? So I can just, so that is to say, last year's budget accounted for 3.5 FTE, including, you know, when somebody's used maybe only 10% of their time for a specific skill set. This year's budget, I am intending for that to be for 5.5 FTE. So two additional staff equivalent. That doesn't mean I'm gonna go out and hire 2 new people,
Right.
right? That's 2 staff equivalent that we can use.
The amount of time.
We are doubling the number of grants that we manage. So we're going from 15 to 30 this year. We review every single grant recipient's funding request for funds all of the receipts, invoices, staff time spent before they get a check. That means we don't have to do an audit for them retroactively and pull back money from them because we found a mistake. So that's a proactive thing that we're doing that is time consuming, but ensures that every penny is being spent the exact way it was intended to. Maybe in a couple years down the road, we can move to a system where we approve and do an audit. But right now, in the early years of this, where we're trying to build capacity within the organizations to fit our funding model appropriately, to be proactive and make sure that they know what needs to be submitted and are spending the money appropriately and not have to pull back money from them, I think has been a mutual benefit on both sides of it. So that doubles this year, right, from 15 to 30. The other thing that we need to address as we update our work plan this next year is we have an opportunity to maybe pilot this year a different type of funding in addition to just our traditional grants, especially when we're considering how different some of our programs are, where some are including fee-for-service revenue and others are not. And by piloting something this year, it allows us to get a better feel for what we might want to include next year as part of our 3-year plan update, if we want to solidify multiple funding options and not just one bucket of funding for every type of program. So when I talk about 2.0 FTE increased, that's where I anticipate a lot of time. The other thing we have to do this year is we have to update our 3-year strategic plan, right? So we're doing that on top of continuing to manage the grant program, putting out a new notice of funding, and evaluating all these programs and putting out some of those nice visualizations and reports to measure the success. So we've got a lot of work ahead of us this year. It definitely will be the most labor-intensive year, but I do feel that this budget will be able to cover us to do that.
Okay, so I will need a motion to approve. Did we fully vote on that? No, we have not voted or approving them.
Oh, yeah.
Okay, so did you have more to add?
I do not.
Okay, so I need a motion for approval of the 23 budget.
I make a motion.
Okay, I need a. Any further discussion?
Tim, are you?
Tim, are you trying to say something?
I was about to second, but you beat me to it, so I'll go back on mute.
Yeah.
Oh,
Sorry, Tim.
Okay, so hearing no further discussion needs, all those in favor, please say aye. Oh, wait a minute, voting. It's money.
I almost
Okay.
reminded you, I bet you.
Dr. Copeland, Dr. Jardini,
Yes.
Dr. Gorski, Richard Cooter,
Yes.
Wendy Larson Bennett.
Yes.
Tim Neighbors,
Yes.
Linda Sandquist.
Yes.
Mariana Body, yes. Motion passed.
Thank you for the information.
Yes, and I just need to comment. If you read through this proposal, budget proposal, all the results from last year, it's an incredible report. I just hope whoever is recipient takes the time to read through it because it's amazing. All the time and attention to detail is in this report. It really is. It's just amazing how thorough it is. So thank you, Jason, and your team, whoever else was involved.
Well, thank you. And we are, did receive most, if not all, of the end year reports, performance reports for each of the funded organizations. So I don't want to commit to August, but certainly I think by September, you should see a full 12-month performance report for our first year of grant funding.
Okay, thank you. Moving on, for discussion items, we have the system coordination plan drafts. So we've already begun discussing, but is there any other, it was in your packet, obviously, so any other discussion, questions?
I thought it was good.
I mean, I thought it was a masterful presentation, frankly. I mean, you guys, again, did a really nice job of pulling together, and there's a lot of evidence-based things that, that you're speaking to and just trying to, that's what has to happen. I mean, this is not gonna work unless, we have the input from what it is you're talking about, to pull these people together and keep the silos from forming.
Next time I'll use Dick's words, masterful.
It was, yeah.
No more good, it was masterful, I got you.
All right. So,
So upon, if there's any updates that anybody does have, even if you're thinking of it as you're, sitting at home over the weekend contemplating how to coordinate a system of care, and on your Sunday as you drink your coffee,
right.
and you want to
exactly,
email
yeah,
us,
I
we'll,
want that, yeah.
we can make some updates to that if needed, and then we'll put it on the August meeting packet for approval. And then we can start to then take those specific strategies, and in some cases, we might identify that there's somebody already doing it. I don't know that that will be the case in most of these areas. I think a lot of them are areas that nobody is doing right now. We can coordinate with groups like the Youth Mental Health System of Care to see what some of their strategies are moving forward that might align with this. There's things that we can do out for hire, and there may be things that we can do as a staff team. So we can kind of start to identify what the different opportunities are to implement these things.
Great.
And at some point, we'll coordinate with current grant recipients also to ask them those questions about. Correct?
Yeah, so we do a learning network collaborative
Right.
meeting, so we can certainly bring up some of these systems coordination strategies as part of that meeting to get input and feedback. I think we may have at one point, certainly on the workforce one, I know we talked a lot about that. We occasionally go to other network meetings as well of people doing the mental health stuff. I know ride sharing came up at one of those meetings, so through our convened meetings or through other convened meetings, we can have those conversations.
Because there's starting to be some great things going on. That we,
There's a lot of convening happening.
yeah. Now we need to do the,
Oh, it's a good place to start.
let's step off the cliff. part.
Okay, moving on to other matters. I have nothing under other matters.
I would like to make a motion to adjourn.
But, somebody was recognized for 40 under 40, right?
Yeah.
I think it's wonderful, Jason.
That's other matters, that's great.
Yeah, I think the fact that, and Dick, I wasn't making fun of it. Masterful is probably, because of you folks, and I mean this sincerely, and I think I might be speaking for all of us. Great job.
Thank you.
And I was really proud to read that and thought, I know this guy, and thought that was really good that you were recognized for that.
Thank you.
So terrific, good for you.
Not only was Jason, but his better half.
My wife was also recognized.
Oh, really?
Yes,
Yeah.
so the duo. Yeah.
And her too.
A double threat. Huh?
That's right.
Love it.
Dynamic.
That's great.
duo.
That's
But
great.
anyways, Jason,
That's good.
well done.
Thank
Love
you. Appreciate that.
You bet.
Okay, so we have to vote, I guess, because we have the motion made. By
Wait a
Dick
second.
All right.
and Linda.
Yeah.
All those in favor, please say aye. I can say aye for this one, correct?
Tim's on there.
No money, no money.
Good, Tim.
And Tim,
All right,
Take care of yourself.
yeah, please.
All right.
you're well, Tim.
Yeah, I was reckless on vacation,
Oh,
maskless the whole time.
oh.
Yeah. See, that's what happens when you go to Florida. It just gets you.
How about, I'll throw this out there. Can we maybe meet for lunch? No?
No, because
can't
it's
do
a
that?
public meeting.
Oh, that's right. It's like,
Unless.
I think we can meet long as we don't discuss anything with the mental health board.
Yeah.
It's fine.
just sit down and say, hey, how you doing? How you doing?
Because if that's the case,
Yeah.
all the politicians
we
won't be
get
able to go to the
together
parade.
I just thought, why can't we just have lunch? We're gonna meet my first Wednesday, so let's just all get together, like, let's just have lunch. Some non-formal way of just talking with each other.
Getting to know each other.
Yeah,
But that'd be fun.
what do I know?
We'll put it on the next meeting agenda. How's
Yes.
that?
Okay.
I think that's good.
All right.
Okay.